Hello everybody and welcome to the Thursday edition of Video Clips. I have a couple of topics that I want to talk to you about today, starting with antidepressants. And this has become a pet topic of mine, not because I am fond of antidepressants, but because I think they're so inappropriately prescribed. So the British Medical Journal recently featured an article that was essentially a debate between two physicians, one of whom, Dr. Des Spence, who says the drugs are prescribed too much for too long and have few, if any, benefits, and then the other doctor, Dr. Ian Reid, insists that the drugs are beneficial. Now, it's not surprising Dr. Reid is a psychiatrist, and psychiatrists tend to favor the prescribing of these drugs. Now, among Dr. Spence's allegations are that the current definition of depression, according to the current DSM, or Diagnostic and Statistical Manual of Mental Disorders, is so vague that it leads to mass overprescribing. And I have looked at these guidelines, and really, on a bad day, I probably could qualify for medication. He's also bothered by the fact that 75% of the people prescribing the drugs have some type of tie to the drug companies. He cites a Cochrane review showing that only 1 out of 7 patients benefit from taking the drugs at all. Now, the debate was inspired by the fact that prescriptions for these types of drugs went up by close to 10% in 2011. Now, Dr. Reid, the psychiatrist, argues that that's because people are taking more drugs as a result of long-term successful treatment. Spence says it's because the physicians are prescribing more drugs to more people. But it really doesn't make any difference. It's sort of like splitting hairs. If the drugs are ineffective, which most studies show they are, then the increase in the number of prescriptions being written simply can't be justified. In fact, many studies show that the patients get worse instead of better. And I did some extensive reviews last year of books on the topic that I think are must-reads, like Anatomy of an Epidemic. And a lot of you have written to me saying that you have read the book or are reading the book, and I'm glad to see that. Well, it's a good time to focus on this discussion because the recent murderous rampage in Sandy Hook was perpetrated by a person taking psychiatric drugs. And according to an article posted by one of my new favorite doctors, Dr. Peter Bregan, on January 13th of this year, most of the major violent acts like this, think Columbine or the theater episode in Colorado, were also committed by people taking these drugs. And the drug companies work very, very hard to make sure that people are not aware of the fact that their products increase the risk of both suicide and violence. In the meantime, in response to Sandy Hook, and this is where I just get so frustrated sometimes I could scream, our politicians are focused on addressing the problem through gun control or increased mental health service. Now, while a discussion of gun control might be appropriate at some point in time, it has nothing to do with stopping the type of violence that happened in Sandy Hook. And driving more people into the offices of psychiatrists to take more of the drugs that tend to lead to the violence isn't going to help the problem much either. It's going to make it worse instead of better. The thing that would make it better is having far fewer people taking fewer psychiatric drugs. That's the best way to start curbing the violence. And discontinuing the use of the drugs altogether would be the best option and a great step in the direction of improving public health. So I'm anxiously awaiting some news commentator or influential media person to pick up on this story and start telling the truth about this whole issue. It just disappoints me greatly that the discussions at this point in time, I don't see anything productive going on in the discussions about how to address what happened at Sandy Hook. So I'll keep talking about it. Send this video to some people you know so they can keep talking about it too. Maybe we'll spread the word faster. The other thing I want to talk about, there's so much confusion about everything out there. It seems that that's what I do here every Tuesday and Thursday, is clear up confusion about some issue, whether it's diet or medicine or something else. And misinformation about diet is so common that it's no wonder everybody's confused and they don't know what to do. Well, the British Medical Journal just featured an article claiming that egg consumption doesn't increase the risk of coronary artery disease. And of course, as soon as it came out, it made headlines around the country, and then people start emailing me asking me if it's true, and I detect a little tone of hopefulness in some of the messages. My gosh, is it okay to eat a lot of eggs? Well, as usual, if you go back and read the entire article, which I always endeavor to do before commenting on these things, you get a totally different understanding of this than if you just read the newspapers and headlines. So I'll give you a little fact outline of the study. It was a meta-analysis, which means that you look at data from a lot of studies to summarize. And the researchers identified 616 articles from PubMed and 824 articles from Embase published prior to June of 2012. There were 8 studies that met their selection criteria. The first obvious problem here is that these 8 studies do not represent a preponderance of the evidence. You've got another, 1,400 and some articles out there. So egg intake was extracted from food frequency questionnaires, and while there's some good information to be gleaned from these, research has shown that self-reported food journals are often incorrect. People tend to overemphasize the good things they eat and underemphasize the bad things they eat. I don't know, they must be trying to impress the researchers, but the researchers even stated misreporting of intake was inevitable. That's a quote from the article. Another limitation is that 1 additional egg a day or 1 less egg a day is unlikely to have much of an effect. We know, and you guys have heard me harp about this for years, that it is the dietary pattern that makes the big difference when we're looking at health outcomes. And the researchers also acknowledge this, and here's another direct quote: compliance with general dietary recommendations instead of simply reducing egg consumption could have a greater effect on the risk of cardiovascular disease. So one thing that I hope you're picking up on here is that the researchers and what they wrote in the article really toned down a whole lot from what the headlines are saying. It's likely that the subjects in the studies that they included in the analysis were eating pretty traditional diets centered around meat and dairy. There was nothing in the selection criteria that said they were looking for people with differing dietary patterns. So the bottom line is that this study doesn't show that eating eggs is a good idea or that egg consumption doesn't contribute to increased risk of coronary artery disease. It doesn't really tell us much at all. It's the interpretation of the study and the reporting of it by the mainstream media that's gotten it any attention at all. So it doesn't mean that eggs can't be included in a wellness forum style diet. They're just part of the 2 to 3 servings a week of animal food maximum that people can eat, assuming there's no dairy and the animal food is organic. There's no special dispensation for eggs. So if you were hoping for me to give you permission to have a 3-egg omelet for breakfast tomorrow morning, well, sorry about your luck. Okay, well, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next Tuesday.